starts out by talking how you identify the patient, and again, the wristband, ask them their name, spell the name, medical record, social security number. If it's an outpatient, request information such as birth date, social security number, things like that. On the order, it says check the chart or prescription if brought in by the patient. Okay, y'all do that? You guys get to see the prescription?
Yeah.
The chart or the prescription?
Online, or sign the order.
Okay. The other thing is the clinical indication should correlate with the patient history. So in other words, if you're doing a indium white blood cell scan and the patient has a if it doesn't make sense, then you're supposed to call a timeout and say, hey, it doesn't make sense. Okay. So the other thing is there's a book that shows indications. Your Shackett book. Okay. There's a real quick way to look at something and say, okay, am I doing a study that's indicated? If it's not indicated, you're not going to get paid for it. That's how the insurance companies look at it. Okay. So again, there's your baseline for deciding what's good and what's not good. Has the patient followed their preparation? Okay. And this is very important for PET. Okay. It's also very important for a lot of the other exams that we do. Okay. If the patient is taking medications that interfere with our ability to do stuff, then we have to reschedule. And then the other thing, contraindications. So we're going to come back to this in a second, but I wanted you to just be aware that this is a real quick and dirty study guide, so that you don't have to spend as much time reading the chapter. Make sense? So I've gone for a lot of these different chapters. Okay, but what I wanted to get into, by the way, this stuff down here, body mechanics, they do have this on your board exams. So they'll ask you for what is the base of support? Okay, that's your feet. Okay, it should be kind of a wide stance. And body mechanics, what's the definition of it? Proper body alignment, movement, and balance. Okay, so you don't get injured. You should know what the center of gravity is. Okay, on most humans, where is your center of gravity? Pelvis. Yeah, it's just your abdomen, pelvic area. Then it says body alignment when lifting objects. Bend the knees and keep the back straight. Avoid twisting. But anyway, this is also a good little note here. Is it better to push or pull? And it says push rather than pull. Okay. But anyway, so it goes through that. There's also some safety tips in here. Okay. So we've got drug administration. They typically will ask you something about the 5 rights. Drug dose, patient, time, and route of administration. Okay? What is that? Whoever designed this thing. Okay. You should know the different routes of administration. Some of the other ones that they don't have up here. Okay, so we've got oral, inhale, sublingual, topical, rectal, IV, intrathecal for our... What exam does an intrathecal injection?
BE.
CSF.
BE?
CSF leak.
Yeah, CSF leak. Yeah. Either that or a cisternogram. Okay. And notice where, they're going to ask you where it's injected. It's a subarachnoid space. Subarachnoid space of what? Meninges. Yeah, remember you've got 3 meninges. You've got the dura, arachnoid, and pia. Okay. And then it tells you the recommended needle size and gauge and all that stuff, but that's not really important. Okay, subcutaneous. Does anyone know a drug that's injected subcutaneous?
Pentagastrin?
Pentagastrin, anything else?
TB.
TB, I was gonna say that too.
TB. Epinephrine.
Oh.
Yeah, if you have an allergic reaction, they're gonna inject epinephrine.
None of
So,
those
I
things
thought that was
go.
intramuscular.
Huh?
I thought epinephrine was intramuscular.
yeah. You could either intravenously or, the intravenous we use a 1 to 10,000 dilution. Subcutaneous, it's a 1 to 1,000 solution. Intramuscular, intradermal. Some of the other ones, there's also intra-articular.
What's
Um,
intradermal?
Between the skin, the layers of the skin. Because they're subcutaneous, it's just under the skin, but intradermal is between the layer.
So it's even more superficial than
It's actually more deeper. I think it's more deeper than intradermal. Subcutaneous is just barely into the,
No, I think it's more superficial, look, the angles 15 degrees. It have to be more superficial.
Does it say
True.
What do we have
between
over
layers
here?
of the
Is
skin?
subcutaneous is 45? Okay, yeah. Okay. Then there's also, we put down rectal, because they have, there are suppositories that you can put in stuff like that. But anyway, so that's an important thing to know. The infection control, very, very important on this one. They're going to ask you, basically the hand washing typically shows up there. How long do you need to wash your hands?
15 seconds.
Yeah, 15 to 30 seconds. So at least 15 seconds. Okay, remember that now we're using what they call standard precautions. Okay, there was universal precautions, now it's standard precautions.
It's the same thing, right?
No, it's not. That's what it, in 1991 they went, it sounds the same, but they're just taking more other routes of spread that the disease can take. They add different other methods. Before they used to have disease-specific, where you have like enteric isolation, you had blood isolation, you had respiratory, And now we just consider the whole patient one big massive infection. And, get a blowtorch and fry them before you touch them. Okay, vital signs, you guys should all know the normals for that. Okay, if you haven't seen it for a while, it's a good opportunity for you to remind yourself of what the normals are. God, my eyes are really bad.
Because you didn't sleep last night.
Huh? Actually, it is. It's a combination of blood pressure, lack of sleep. Okay, but anyway, so remember that when you're doing oral, you have different ways you can do temperature: oral, axillary, rectal. Which one is the most accurate?
Oral.
Actually, the rectal is. Okay, that measures what they call the core temperature. And so the other ones, like oral isn't as accurate because if you're breathing through the mouth or you just had a hot drink or a cold drink, when you wanted to stay home from school, you'd have a hot drink and then, oh, Mom, I'm not feeling so good. My God, your temperature is 200. You better stay home from school. Yeah. Tympanic and oral are about the same. Yeah.
I'm going to school.
Oh,
I need a more accurate reading.
Yeah, there you go. You had a smart mom and she figured it
I
out.
feel better.
Well, like I used to hold it by a light bulb.
Yeah.
Yeah, because if you brought in hot water or
Put it in a hot milk.
Cool
Yeah.
down.
yeah, the moms would figure that one out. So you had to put it next to like a hot light. But you should know that like 98.6. Okay, so it's normally 1 degree hotter if you do rectal, and 1 degree cooler if you use axillary. But rectal is the best. The only problem is that you normally have to hold on to the thermometer so it doesn't get sucked in. You also have to be prepared about vagal response.
Seriously?
Seriously.
Like passing out.
And you get those x-rays at abdominal pain for an object, dude.
Yeah.
It gets sucked in.
Yeah, people don't understand that when you put something in your rectum, there's what they call reverse peristalsis, because normally your intestines kind of move things back and forth to sort of, chew them up. And you get to a certain point, you get reverse peristalsis, and that's when those objects get sucked in. But being that as it may, what else were we going to say? Okay, rectal thermometers have the risk of what they call a vagal response. Okay, person may pass out. Why?
Because you're stuck in
Oh my God! Ah! Actually, there's just a physiologic problem that occurs when you stimulate certain nerves in the rectum. So what nerve is it that we stimulate? Okay, the vagus nerve. Okay, the vagus nerve runs from your cranium, from the pons down to the anus. And what happens when you stimulate it? It's a parasympathetic nerve. Slows things down. So it slows down go ahead. Well, what happens is your heart rate goes down. Okay, your heart rate drops. And then that causes your blood pressure to drop. For you, you should know what drug is necessary to bring the patient back. No, not epinephrine. Not the...
What is that? Ammonia?
It's
Yeah, just pop the pill.
ammonia, no. Okay, it's atropine. Atropine, if you give the patient atropine, their blood pressure should start coming up. If it doesn't come up, it means they're going into shock and you're probably going to be doing CPR shortly. Okay? Moving on down here, okay, the pulse. You should know where to take pulses. Okay? And it says here the strength. So if it's a really, really bounding pulse, or is it a weak, thready pulse? And the regularity, so is it a regular pulse, or is there arrhythmia? Normal people, for adults, 60 to 90 beats per minute. Children is 100, and infants is about 110 to 140. And in fact, when an infant's pulse goes below 100, they start getting ready for CPR. Okay. The radial pulse, we all know where that is. It's on the lateral side of the forearm.
Thumb.
The thumb side, yeah. We have the carotid pulse. Now, the carotid pulse is a more reliable one. That's what they call a central circulation. Same thing with the femoral pulse. These are also, the femoral pulse is good, especially when you have trauma to the lower extremities, to ensure that there isn't an occlusion. Okay, because that and the pedal pulse, the pulse is just above the ankle. Popliteal is behind the knee. I don't think I've ever taken that on a patient. Temporal pulse, especially on kids. I remember when you used to get your parents upset, you could see that throbbing vein, or that throbbing
If you're sleeping too sometimes.
yeah, you can hear it now. Dorsalis pedis, this is the one that we normally check if we think that you may have damaged blood vessels or arteries going down to your legs. Posterior tibial pulse on the inside of the ankle, and then the brachial pulse. What is this freaking thing? Look at this. I'm not even touching it this time. Brachial pulse is what we normally use on kids. Remember, that's between the elbow and the shoulder. Okay. Respirations. Notice for adults, 15 to 20 breaths per minute. That should be beats per minute. Screw that one up. Okay. Children and infants have a little bit higher respiratory rate. Normally they have one breath every 3 seconds, so they'll have about 20 breaths per minute. Adults, a little bit less. One of the things I hate to bring up my father-in-law, but yesterday I knew he was in trouble because what type of a breathing rate would you expect for a person to be getting ready to either die or have a resuscitation? Well, slow, below 10, but over 30. Okay. Now, my father-in-law yesterday, he was breathing at 34 breaths per minute. Yeah. So we typically give morphine, not only for pain, but also to slow the breathing. Now, the thing was, after they gave morphine, the breathing rate didn't change. That's a really bad sign. And it was about 2 hours after they gave the second dose of morphine that he passed. But the person who is breathing more than 30 breaths per minute, that is considered a crisis or an emergency situation.
Wouldn't you want to increase this?
I was like, huh?
No, sorry, go ahead. No, I don't know what he asked.
Oh, I'm sorry.
Oh, how much morphine?
They
Do
gave
give
him
to slow down breathing?
0.2 milligrams. They gave it every 2 hours. But I mean, the thing is that, you know, he quit eating and drinking on Saturday. So usually when people are dying, that's what they do. They'll stop eating and drinking, and once in a while they may get a burst of energy. But usually when you have that high of a breath rate, the time is getting pretty close.